Heavy periods is one of the commonest reasons why anybody would come to see me. And what do we mean by heavy periods? In the past, people used to try and define heavy periods as having bled a certain amount, which was always interesting because it's not easy to measure how much somebody has bled during periods. I'm glad to see that eventually we've all agreed if a woman says she has heavy periods, we need to accept that. And that's the agreed definition. Some women will mention things such as passing big clots, flooding to the point where they have soil through their clothes, and sometimes using protection such as tampons and pads at the same time, something that we call double protection, and sometimes not being able to leave their house because they bleed that heavily. This would often affect the type of clothing they choose to wear, often wearing black clothes and scared of wearing light colored clothes. If we think about what are the causes for heavy periods, these could be a number of reasons. So these could be something due to a condition called fibroids, which are growths within the muscle of the womb. This could be due to conditions such as endometriosis or adenomyosis, and this could be due to conditions such as dysfunctional uterine bleeding. Treatment for heavy period depends on the underlying cause. I would divide these into medical options and surgical options. So if there is no significant problem with the structure of the womb, then medical treatment options could be appropriate, such as a combination of tablets called tranexamic acid and mefenamic acid. Hormone tablets or injections or coils such as an IUCD is also an effective treatment option for heavy periods. The advantage of something like an IUCD is that it is easy and simple and can often be done in outpatient setting in under 10 to 15 minutes. And many women would prefer this as an option over more invasive options. Other options would be a procedure called endometrial ablation, where the lining of the womb is treated to a point where it stops growing and proliferating and results in much lighter or no periods. This treatment option is only reserved for women who have completed their family and have a womb with a normal shape and size to the cavity of the womb. For many women, these treatment options may not be suitable and they may require some form of surgical input. And this could be either in the form of a hysterectomy, where the womb needs to be removed, or it could be in the form of myomectomy, where the fibroid is removed surgically and the womb is stitched back together.